Um, the big questions when I started my career probably related to how best we could prevent conditions that we had recognized for some time and where we knew that we had in place both the science and the evidence, for example, for vaccines, and to try to understand how can we expand the coverage with vaccines for vaccine preventable disease.
When I entered the field, there was a lot of low-hanging fruit. There were big relative risks to be discovered. The field has become very much focused on genetic effects, at least part of the field, and these effects are very tiny, and it means that the studies that are being done have to be huge. They're very huge collaborative studies, and they're very expensive.
We have to think more in global terms because of the rapid movement of people from one part of the world and with them the diseases that accompany them. And I think that, that goes probably to one of the most important and major accomplishments that has occurred, and that is the improved surveillance systems, and so much of that is directly attributable to health information technology. And I think, today in public health is essential. And quite a few years ago when I was starting all of this, we were still doing a lot of tracking on paper and telephone calls and very primitive computer systems.
Because of my experience here, I realized how important prevention was, and it really changed my career. And that was what was called an invasive cardiologist. That's what we called them in the old days, to prevention. And in fact, when I was here, I was able to become the first director of a project called the Multiple Risk Factor Intervention Trial. Dr. Fred Stair, who was then the chairman of nutrition, was the one that steered me that way, and that really changed my career.
Absolutely. Oh, dramatically. I thought of myself more as a clinician, and when I went to the School of Public Health, my thinking was already beginning to change, my philosophy about how I wanted to devote my life. And from there on, I knew that I was going to be an academician, pursuing research, teaching, mentoring, and ultimately conducting my professional life at a School of Public Health.
I knew that there was a time in my career that I certainly wanted to have some academic credentials in public health. And this was a place for me to acquire those additional credentials. And in the process, that has opened up some wonderful opportunities. And I, again, have to attribute that to the Harvard School of Public Health.
Well, I think anyone who starts out working in a place that has people in different disciplines, or at least access to people in different disciplines, will do well, because the cross-fertilization is really very useful and helpful. And having a strong biological background and basis is also very important, because the field has really gotten more into the underlying mechanisms.
Well, I advise a lot of people to get training in public health. I mean, one outlet for public health is obviously to work in various public health institutions, but one that's sometimes overlooked is clinical medicine. I think it's particularly important for faculty members in medical schools, as many as possible, to have training in public health, because it gives you a bigger picture. When I went into this school, I was an assistant professor at Harvard. I was head of a cardiac cath lab right across the way at the Beer Bend Brigham, and I was doing all the things you're supposed to do, but I felt I was missing something. And when I came to the School of Public Health, it really changed my whole career. I began to see that the real issues are prevention and for help of the entire population instead of individual patients.
Learn the fundamentals. Learn the fundamentals of epidemiology, biostatistics, pathology, physiology, pathophysiology, toxicology. Get those basic concepts and principles down, and then you'll be able to apply them to whatever problems you seek. The other thing I think is important to stress is that learning is a continuum and you never stop being a student. So if you really want to master your craft, you have to continue to learn, to change ideas and attitudes and the knowledge base that you had years ago.